Go say hi. There you go.
This is Wesley here.
That's Wesley. He was born in 2006, and that's when we finally got health insurance. We had a few different policies over the years, always had something excluded from it, even something as silly as ear infections. And I mean, what kid does not get ear infections? So, I mean, silly stuff. In July of 2009, he had eye surgery. We discovered he had sudden onset of a condition called strabismus in the eyes, and his right eye needed surgery. So we had the surgery. And in less than a year later, we said we needed new insurance. What we had was killing us for our premium. And this was right around the time, right after the act passed. The insurance company gave us an affordable rate. We were looking for a very affordable plan. And when she told us we were approved, my immediate response was, but what's not covered? And I knew full well we were going to have an exclusion for my son's eye. And she said, you're covered. Nothing's not covered. And I said, okay, I'm not being very clear here with my questioning. What about my son? She said, yeah, your son's covered. I said, no, you're not understand. What if he needs another surgery on his eye? Are you going to pay for it? I said, yes, he's covered. And I was shocked. And she said, we can no longer exclude pre-existing conditions for children. And it didn't hit me until later that night when I was talking with my husband as to why she said that. And we started talking about it. I said, wow, something affected me personally from, the government was really shocking. So not only do we have a more affordable plan, but my son is now covered no matter what happens. It is routine for children with strabismus to need multiple surgeries. And I know now that that's not going to have to come out of our pocket, which was a big fear. So very thankful and very grateful. Thank you so much for everything you've done, President Obama, and everything that everyone has done to push this through, because it's really made our life so much less stressful. It's just an average American family.
That's a wonderful story. Thank you, Don. Next, I want to talk to Gail, who flew down here from New Hampshire, and I had a chance to talk to Gail a couple of days ago. I had actually received a letter had been passed on to us from Gail's husband telling their story, and so I just was so touched by it, and it was wonderful to have a chance to speak to her personally. But Gail?
That was awesome, too. You made my day. In March of this year, I was diagnosed with high-grade stage 2 non-Hodgkin's lymphoma, and I was uninsured. I work full-time as a preschool teacher at a Montessori school that does not offer insurance to their employees. So I was scared to death. More, not as much, oh, I've got cancer. What am I going to do? It was, how am I going to pay for these outrageous bills that are going to come our way? So then we would have to have gone into our retirement fund and used all that up. And we have one son in college and one on the way to college in 2 years. We would have had to use all the money that we saved for those to pay for my medical bills. And then when we heard about the high-risk pool and that it was in effect in July 1st, we got right onto it. We called people. We got all of the criteria in order so that we were actually insured on July 1st. My doctor let me wait for 3 months to start chemotherapy and radiation. And on July 5th, I started chemo, and I am doing radiation right now. I'm feeling great. And if it wasn't for this bill, I would have probably not been feeling great because I would have been so stressed out and worried about paying for my medical bills that now I can focus on my health instead of focusing on how am I going to pay to get better. So I personally thank all of you and President Obama so much. I mean, you do not know how this has changed my life and how grateful I am to you.
I really appreciate that. And I should have mentioned just for Gail, children are with pre-existing conditions are covered. We had to phase in the adult side of pre-existing conditions because it's more complicated trying to get that whole pool of adults. But what we did in the interim, by 2014, we're going to have in place a rule for insurance companies that they can't bar people, anybody, not just kids, but anybody with pre-existing conditions from getting insurance. But in that interim, over the next several years, over the next 4 years, we want to make sure that folks like Gail got help. And so we've set up these pre-existing insurance pools state by state. And Gail, I think, was the first person to sign up in New Hampshire.
On the ball.
Right. So we've got thousands of people across the country who are now signing up, and states are working with Kathleen's office to get this set up so that they're able to get the coverage they need in a way that's actually affordable. I mean, in some cases, you had situations where you could get theoretically insurance if you had a pre-existing condition, but the costs were so exorbitant that it was just impossible. And then some people in certain markets, you just couldn't get insurance at all. And so now, we're able to provide an interim step that helps directly people like Gail, and we're really proud of that. So with that, what I want to do is I just want to open it up for any questions, comments, concerns that people have. We're focused mostly on healthcare, but if you want me to talk about what happened to the Redskins on Sunday, I can talk about that too. Yes. Here, and let's make sure everybody gets a mic so that we can hear folks. And introduce yourself if you don't mind.
Norma Byrne. I'm from Vineland, New Jersey. Mm-hmm. I'm very curious to know what can be done about the insurance companies and medication. As it stands now, the insurance companies rule when the doctors order. They either refuse, or it's a generic, or they have to go back to the doctor and argue with his office as to whether or not you can have it.
Well, under Medicare, prescription drugs are covered under Part D.
Yes.
But for a lot of seniors, they still haven't been affordable even under Part D. And so one of the things that was part of the Reform Act was us slowly phasing out something called the donut hole,
yes,
which I'm sure you're familiar with. Essentially, the way the thing was set up when they set up the prescription drug plan program under Medicare, under the previous administration, you were covered up to what was it, a couple thousand, $3,000, $2,000. Then once you hit that threshold, there was a hole, that's hence the term donut hole, where you weren't covered for another several $1,000s, and then if it became so extreme that you had to still buy more drugs, then you would end up being covered again. So you had this donut hole. A lot of seniors fell into it. One of our main priorities was saying, let's close the donut hole. And we are beginning to do that now, first by providing some supplemental assistance to seniors. A couple of million seniors have already received, or is it about 1.5 million seniors have already received checks of $250.
I was able to get my heart medication once that check got there.
Well, so you've already received it, and it
yes.
helped you get
yes.
Some heart medication.
Medicine I couldn't afford.
Well, that's a wonderful story, and that's exactly what we want to make sure of, is that you don't have to make decisions about, do I get this medication or not?
And I thank you from the bottom of my heart.
Well, I appreciate that. But you're making, in addition to that, another point, which is that a lot of times there's a process of decision-making between doctors and Medicare about what drugs are going to be covered. And one of the things that Kathleen is trying to do is to make sure, I don't want you to have to use your health care plan right now. One of the things that we want to do is to make sure that we're trying to figure out how can we simplify and make it easier to understand what prescription drug plans are out there, so that you know ahead of time if you are primarily concerned about your heart condition and the drugs you need there. Are you able to find the plan that you need that covers the drugs that your doctor is recommending? And that's something where I think we can still make some significant improvements. Kathleen, do you want to add something to that?
Well, just as the President said, one of the things that will become clear when the new Medicare information comes out about the 8th of October, you'll have a re-enrollment period, is I think two pieces of good news on the drug side. One is that we made plans be clear about what drugs are covered so seniors can make the right choices. If you need heart medication or liver medication, you make sure you sign up for the right plan. In the past, that was very unclear. And secondly, starting in January, This year that was a one-time $250 check. Next year, a 50% decrease in all of the brand name drugs in the donut hole will go into effect. And we received some good news from companies that every company is going to participate in that. So the kind of feature that begins to phase out the donut hole, it starts next year, and half of it will be gone. And that's going to be a huge help. So $250 didn't cover a lot of the drugs that you have to buy in the donut hole, but next year they will be essentially a 50% decrease, and that applies across the board to all companies. And Congressman, I know that was a big issue in the House, and one that people felt very strongly had to be part of the Affordable Care Act, getting rid of the donut hole. The President certainly supported that, but it's going to be very good news. People said it would never happen, and drug companies all stepped up and said, we will continue to participate, and yes, it will happen.
Good. Yes.
Hi, President Obama.
How are you?
Good. My name is Nia Hurd-Garris. I'm a fourth-year medical student at Howard, and I'm one of the people that has not been able to go to the doctor, ironically, because I'm in medical school and I can't even go. So I just wanted to know, what steps are we going to take after it's passed and goes into full effect to encourage young people to go see the doctor and to take preventative steps just as older people, because I feel like a lot of times we're left out.
Well, first of all, as I said, up to the age of 26, you're going to be able to stay on your parents' coverage, and that's important for a lot of people.
It's exciting.
You look like you're, what, 22?
Yeah, I wish. 24.
Okay.
So
What? Well, I mean, I wasn't that far up. I wish, let me tell you, 24 is just fine. So first of all, you'll be able to stay on your parents' policy for another couple of years, and that gives you obviously some peace of mind. The second thing that we're already doing is all the policies now are going to cover preventive care. So, getting a mammogram, that's got to be part of your policy. And you no longer have to pay significant out-of-pocket costs that may dissuade you from getting the kind of preventive care that you need. And if you're a medical student, you know better than I do that so much of keeping ourselves healthy is knowing what's going on and going in and getting regular checkups and being able to monitor your health. My mother died of ovarian cancer, and she did not have steady health insurance during her life because she was essentially a self-employed consultant. And ovarian cancer is a tough cancer. Once you get it, it's tough, mainly because it's typically diagnosed very late. Now, I can't say for certain that if she had been diagnosed earlier, she might be with us here today. But I know that the fact that she did not have regular insurance meant that she was not getting the kinds of regular checkups that might have made a difference. And so that's true for young people as well as old people. The provision that I just talked about, preventive care, if you've got insurance, then that preventive care is going to be covered, and that should make a difference. And by the way, that should save us all a lot of money. I mean, one of the toughest things about this health care debate was, and sometimes I fault myself for not having been able to make the case more clearly to the country. We spend, each of us who have health insurance, spend about $1,000 of our premiums on somebody else's care. What happens is you don't have health insurance, you go to the emergency room, you weren't getting a checkup, something that might have been curable with some antibiotics isn't caught. By the time you get to the hospital, it's much more expensive. The hospital cares for you because doctors and nurses, they don't want to just turn somebody away. But they've got to figure out how do they keep their doors open if they're treating all these people coming in the emergency room. Right. Well, what they do is they essentially pass on those costs in the form of higher premiums to the people who do have health insurance. And so we are already providing these subsidies, but it's the most inefficient possible subsidy we could provide. Right. We're a lot better off if we are making sure that everybody's getting preventive care. We're encouraging wellness programs. where people have access to doctors